and this weakness of the muscles. As Down syndrome, which is a very common disorder, they also have hypotonia in the infancy stage. Apart from that, Williams syndrome, I will show the gestalt figures for that. Certain inborn errors of metabolism, like Smith-Lemli-Opitz, which we commonly seen in our emergencies. Sometimes the child is coming with weakness and UGR and all is there. And cerebral dysgenesis, any malformation of the CNS, whether it is a metabolic or a structural defect or as a part of cerebral palsy. These are non-progressive and they may also lead to neuromuscular disorders. Peripheral nerves and all other things we have already discussed. Now, certain typical clinical keys which we should keep in our mind whenever we are seeing such patients. Deep tendon reflexes are all, as most of us, every time we see CNS examination we do for certain patients, especially for neuromuscular, these will be lost in neuropathies and motor neuron, but they will be diminished but preserved to certain extent in myopathies. Fasciculation is a sign of denervation. Most of the time a child with a spinal muscular atrophy will see that fasciculations in the tongue. And then fatigable weakness, already discussed for NM junction abnormalities. Myalgias are a part of metabolic diseases, and contractures at birth can be a part because of the myopathies and the neuropathies. Wasting of the temporalis muscle and the inability to open the hand after maximum grip, which is seen in myotonic dystrophy. We'll discuss in detail about that, which is a very common disorder in the adults for neuromuscular causes. And then undescended testes. This is very important. Many times in your OPD, as the certain children will be coming, will be having myopathy, or you are suspecting neuropathy, they will be having undescended testes. What is the reason? Because the gubernaculum, which is a striated muscle, so any weakness in the muscle will lead to the weakness of the gubernaculum, and it is responsible for the movement of the testes from the abdomen to the scrotum. And because of the weakness of the muscles, it will be undescended. So we can suspect SMA, myotonic and other myopathies in that. And again, this figure you can see a funnel-shaped thorax. Their ribs are very thin and they are prominent in X-ray. There will be radiolucent. This is typical for a SMA child. Again, dysmorphism is very important because most of these disorders are having certain amount of dysmorphism. This, I think most of you must be able to decipher. This is a child with Down syndrome, the typical simian crease and the typical dysmorphic feature. And in this slide, I have shown the typical myopathic faces. Now, why such face? Because of the weakness of muscles, there will be sagging of the cheeks. There will be tented upper lip, and the lower corners of the mouth will be like going downwards because of the weakness. Apart from that, it will be an expressionless face. You can see the child, they don't have any expression. In such a child presenting with weakness, we should always suspect about the myopathies. And again, as told initially, certain